Can you enroll in Medicare after age 65? The answer is yes. Today we'll show you the step-by-step instructions to get you enrolled in Medicare and without penalty. Andy Stamus here with Medicare Mindset. Sometimes it doesn't make sense to enroll in Medicare when first eligible. But when you do decide to transition after age 65, it's a pretty unique process. Let's get into it. This entire video assumes this Medicare enrollment is occurring when covered in a group health plan based on your current employment or your spouse's current employment, or up to 8 months after losing group coverage. It's called an SEP, or Special Enrollment Period enrollment. How to do this depends on whether you initially enrolled in premium-free Medicare Part A during your initial enrollment period. If you didn't enroll in Part A initially, the process is a little different, which we'll briefly summarize at the very end. But first, let's look at the most common scenario where you already enrolled in Medicare Part A when you turned 65, and you just need to add Part B since you're losing group health coverage soon. You'll need to complete 2 paper forms and submit them to Social Security. The application for enrollment in Medicare Part B is Form CMS 40B. It can be accessed online at ssa.gov by typing in 40B in the site search bar. The request for employment information is Form CMS L564. It can also be accessed online at ssa.gov by typing in L564 in the site search bar. This is the form that verifies you have been covered continuously through a group health plan, and you will not be assessed a late enrollment penalty for Part B. Your employer will complete this form on your behalf. Let's take a look at these forms so you can get acquainted with them and avoid making mistakes. Form CMS 40B is the application for enrollment in Medicare Part B. You will complete this entirely on your own. Numbers 1 through 8 and number 12 are required. It's especially important to put in your requested start date for Part B on number 12. If your spouse is also enrolling in Part B at the same time, a separate form is required for him or her. Now here's Form CMS L564, the Request for Employment Information form. There are 2 sections to complete. Quick note, if you work for more than one employer since turning 65, you'll need to complete a separate L564 for each employer. Also, if you and your spouse are both enrolling at the same time, you will each need a CMS L564. Section A can either be completed by you or your employer. Some employers will do it for you, others won't. The key thing is to get the applicant name and employee name right. The applicant is the person enrolling in Medicare. The employee name is the person who works for the employer. If you're the employee and you're enrolling in Medicare, your name and Social Security number should be listed twice in this section. But if your spouse is the one applying for Medicare, they are the applicant and you are the employee. Section B is definitely for your employer to complete, as they need to certify and sign that you had health insurance coverage as an employee or spouse. And they need to get this right or your enrollment will be delayed. Number 1 should be yes. Number 2 is incredibly important as many employers get this wrong. The question says, give the date the applicant's coverage began. But some employers fill in the most recent renewal date for benefits, but that's the wrong date. What the form is really asking is, give the date the applicant's coverage began initially through the employer. The goal here is to have a date that goes back to when the applicant was first eligible for Medicare at age 65, or earlier. So if someone started coverage through the employer back in 1995, that's the date needed here. Numbers 3 and 4 go together. If someone is still covered by the employer plan, then number 3 is no, and then number 4 is left blank. If someone is no longer covered by the plan, number 3 is yes, and then number 4 should list the date they lost coverage. Number 5 is the other spot employers goof up on. The from date is pretty clear. The date the employee began working for the employer. Then you will enter either the to date or the still employed date. You will use the to date if employment has already ended. You will use the still employed date if the employment is still active at the time this form is completed. Typically, we're doing this form in the months leading up to a Medicare transition, so the still employed date is more commonly used. And then finally, at the bottom, the employer will fill out and sign to validate the form. So now that you have the forms completed, what's next? Well, due to the COVID-19 pandemic, the process is different now. There are two ways to submit the forms. A traditional route is to mail or fax the forms. If you mail the forms, make a copy for your records first, then send via USPS priority mail so you can track delivery. If you fax the forms, include a cover letter and then be sure to call the Social Security office to confirm they received your paperwork. But since the COVID-19 pandemic closed all Social Security offices indefinitely, there's a new method that we recommend considering: online submission. First, you need to image the forms. PDF format is usually the easiest route, but there are other file formats that can work. You can use a scanner to scan the file to your computer as a PDF. And you can also use smartphone apps to scan to a PDF. Worst case, take a very clear picture of the forms using your phone's camera, being sure to get the form fully in the viewfinder, directly above, not at an angle. It must be very clear and easy to read. Then you can save the file and email it to yourself later to be saved to your computer, as you'll need to upload these files to Social Security in the next step. Next, go to www.ssa.gov/medicare-partb-sep. This is where you'll enter the form data into an online form and then upload your completed paperwork at the end. Here's what the site looks like. If the link or website URL doesn't work, you can access it a different way. Go to ssa.gov, click on Menu in the blue navigation bar at the top, then click Medicare. On the next page, scroll all the way down to the section that says Already Enrolled in Medicare. Click the link that says Apply Online for Medicare Part B during a special enrollment period. So now we're at the beginning of the online enrollment process. You need your Medicare number, contact information, a valid email address, and your completed enrollment forms imaged and saved to your computer. Social Security recommends using Google Chrome or Microsoft Edge browsers, so keep that in mind. Go ahead and click the box that says you understand the above statement and click Start Application. You'll notice the next page is essentially an electronic Adobe form of the two paper forms you already completed. Click the yellow Start button, or just scroll down to page 3 to begin. You only need to complete pages 3 and 4 of the online form. The other pages are instructions. Important note, the section names for this online form do not match up with the paper forms you completed. You'll notice page 3 is the application for Part B, or essentially the form CMS 40B. Complete section A, numbers 1 through 7, being sure to write in the statement of when you want your Part B to start, so it should match what you have on your paper form. Continue on to section B. Section B is actually the first half of the Request for Employment Information Form CMS L564. Complete numbers 1 through 6. Move forward to page 4, section C. Section C is actually the second half of the Request for Employment Information form. Complete numbers 1 through 5. Notice that number 5 doesn't give you an option to enter a still employed date. If that's your situation, just enter that date in the To Date field. And then section D is the last item on the application. There is a Verifying Documents section where you can upload up to 2 documents. This is where you'll want to click where it says Click to attach employment verification and upload your completed paper forms. We always recommend uploading both the CMS 40B and CMS L564 at this point. If you don't upload the CMS 40B, that's okay, but you definitely have to upload the CMS L564. That is a requirement. After that, click where it says Click here to sign. This will bring up an Adobe signature box. You can either type in your name, which automatically turns it into a script signature, or you can click the draw option and actually sign on the screen if you have a touchscreen. We just recommend using the type signature option as it's much easier. Once you have the signature in there, click Apply. After this step, you'll enter your email address and submit. The system will send you an email to complete the final step of the application process. You'll get an email from echosign@echosign.com. Be aware that it might end up in your spam or junk folder, so be on the lookout in the next minute or two. You must click the link in the email to officially submit the application to Social Security to process. And then you'll get an email confirmation from Social Security verifying it received your application. Now that's how to enroll in Medicare Part B when you already have Part A. But But what if you haven't enrolled in any Medicare yet and need to enroll in both Part A and Part B? Let's take a look. When you haven't enrolled in any Medicare, the enrollment process must first start online. You'll complete the Medicare-only application online at ssa.gov, and then you'll turn in the same 2 forms as mentioned in the previous scenario. But don't upload the forms like we detailed previously. This is a different process. You can watch our online tutorial on how to enroll Medicare by visiting our YouTube channel or using the direct YouTube link provided at the end of this video and in the video description. After you submit the online application, a Social Security representative will contact you, usually by phone. They will ask you to complete and return Forms CMS 40B and CMS L564 to finalize the application. The Social Security representative will let you know if they want you to mail the forms or fax them. After everything is submitted to Social Security, they will process your application over the next several weeks. Eventually, you will receive a new Medicare card by mail showing both Part A and Part B. You can also pull up verification of this by logging into your online My Social Security account. And if you want to know how to do that, watch this video over here. It shows you what to do.